Welcome to Phoenix Spine and Joint. Thank you for taking the time to review this video, which hopefully will give you, as either a prospective patient or a family member, anyone who's experiencing knee, hip, joint pain, or back pain, you have certainly found the right place. And so I'm here to just basically tell you why we're different, and it all starts with our process. The process of the moment you send an email or the moment you make a phone call, what happens? You'll hear from someone, one of our patient care advocates, within a 24-hour period. And then they'll try and understand and get some insight specifically as to what's your condition, what's going on. We would then work with you to make sure that you get your imaging. And if it's a knee or a hip, then typically we only need an X-ray. But if it's some sort of arthroscopic procedure or if it's a spine-related procedure, then what we would do is make sure that we work with you to make sure you have your MRI, you have some sort of imaging that's at least within the last 6 to 9 months. Once we work with you to ensure that you have a current image or CT scan or X-ray, then we work with you to make sure that we get that into our system and we can help you upload that through your computer. It's all done through secure mechanism. And again, the sooner we get that information, then we can move you through our process even that much quicker to get you to have that immediate video teleconference with the appropriate surgeon. And we like to do that sometimes within 48 hours, and that's a detailed conversation. Some of these last 35 to even 45 minutes, but it gives you the opportunity to ask all the detailed questions you have, understand and learn more about the surgeon, and then they'll be able to share the screen with you, point to some specific issues regarding the imaging, and really help you understand specifically what's going on with your condition and what your treatment options are. If you're deemed a surgical candidate and you meet some of the pre-clearance requirements, etc., then we can work really at your schedule to get you to move through the process and then get you scheduled for surgery. And we have some people scheduled for surgery literally within 7 days after they've had that initial video teleconference. Typically, people may wait 2 weeks or 3 to 4 weeks. It just depends, but we have agreements with local hotels. So we can establish the process and the format from a logistics standpoint and help you and guide you through that at whatever pace is convenient for you. If some people want to stay at more of a 5-star resort, we can certainly assist you with that. Or if you're looking for more of a modest budget, then we can also help you with that. But the beauty of the Phoenix Spine and Joint experience, and the reason why we're having such strong success in the medical tourism arena, is that we've streamlined this entire process to be very patient-centric. We're using technology to our advantage. We have all the tools in place to be able to meet you where you are. We've treated patients from all over the world who come to Phoenix Spine and Joint, and we're very fortunate in that we have world-class surgeons, board-certified, fellowship-trained surgeons, whether it's orthopedic surgeons or neurosurgeons. They're the best in the business, with thousands and thousands of patients being treated over the last several years. We also have the best experience, the best patient experience in the business. If we look at how we gauge the patient experience, we have the patients really tell us themselves. We have a third party that basically does an assessment on overall patient satisfaction scores. If you think of most hospitals, they're in the area of 60 to 70% overall patient satisfaction. We have consistently, for years, been running on an average of 97.5% out of 100 in terms of overall patient satisfaction. If I look at just the last month alone, we averaged 99%. So essentially, every patient who comes through our facility, irrespective of the procedure, is more than adequately satisfied with their results, their outcomes, and they're confident in letting others know that this is the place to go and this is where they want their procedures done. Additionally, when we think of infection rates, you look at infection rates, whether it's in hospitals or ambulatory surgery centers, We're very proud of the fact that within the last 12 months, there's been no infections at our surgery center. And that's something that we're extremely proud of. And when you couple that with overall patient satisfaction scores, those are the types of places when you want premier outcomes. That's the type of place that you want to be looking for as you're selecting where to go for your knee or hip replacement. We will always use the latest and the best equipment. And what I mean by equipment, whether it's a knee implant or a hip implant or different implants that are used for certain spine procedures, we always use the latest technologies that are available on the market. And these are different types of composite materials which we know have better adherence to bone. Everything about these implants are the best, but most importantly is they're designed to last for essentially a lifetime. One of the more common questions I get is, what do these procedures cost? It's all affordable depending on how you really want to take control of your life and to be able to give you the quality of life that you deserve. If you've been told you need a knee replacement or a hip replacement, why wait 12, sometimes up to 24 months? In some of these provinces in Canada, we're seeing these 24-month wait periods. Why have a debilitating quality of life for a 24-month period when you have the ability to come down to beautiful Scottsdale, Arizona, and get this procedure done in a timely and an effective manner? Why wait? Take control of your destiny and your quality of life.